Chairman, dear President, dear colleagues. Just Dr. Sanil asked me to talk with you my own opinions regarding dorsal hump reduction. As we know, dorsal hump reduction is a very common procedure at least in your country, in the Middle East, rhinoplasty patient. And when you go to a street, you can see these types of the noses are very common in India, in Iran, in Egypt, in all parts of the Middle East, and especially in India, you have thick skin also. So I can tell to these groups of patients that they have hump, droopy tip, ill-defined tip, and thick skin, such as a Persian nose. And you can see these are the routine noses that every day I see in my clinic and I operate in the operating room. When you travel to our country to go to Persepolis, you can see this just portrait and pictures of the previous kings of Persia. That you can see that they had the same problem: hump, droopy and ill-defined tip, and thick skin. So it is our genetic, and still now we have the same problem. For me, just hump reduction, after hump reduction, these are the goals after hump reduction and profiloplasty. I want to create for my patients a straight dorsum. I want to create for my patients a strong dorsum. I want to create for my patients a dorsum with a good height, and in the Gale patient, I want to create for my patients a strong, straight dorsum with a little supratip break. So you can see this is before and after. I like this type of the dorsum, straight, strong, and in the females with a little supratip break. And it's a mistake in many countries, especially at least in our country, that most of our colleagues create for our patients a saddle nose deformity instead of to removing a hump and create a nice dorsum. It's a mistake that instead of the creation of the supratip break, they create for the patients a saddle nose deformity and a high slope. So I like this type of the dorsum, straight, strong, and as I told you, I like to create for my patients a nice brow tip line, and it's very attractive after rhinoplasty that the patients has very nice brow tip lines. So please consider to correct the brow tip line. And I like to create for my patients these types of the dorsum. I want to tell you one reality. In our country, many of my patients ask me for a high slope dorsum. I don't operate for that groups of patients. I tell to my patients that I'm a facial plastic surgeon. I know the facial plastic surgery rules better than you. If you want to operate by myself, you must follow me. I will not follow you. Because if in the future the patient has some problem and go to the Ministry of Health or the Medical Council and sue me, when I am there, I can protect by myself because I followed everything according to the facial plastic rules, not according to the request of the patients. I judge some of the requests, some of the files of other colleagues, and some of my colleagues told me, oh, Dr. Ali, the patient asked me to create for her or him a saddle nose deformity or a high slope. I tell to them, no, it's your mistake. You are the doctor and you must follow your own rules, not the rules that the patients ask you. So this is my philosophy, that the patients must follow my rules. That is not my own rules. This is facial plastic surgery rules, not the patient's rules. Please pay attention to this important issue. As I showed yesterday, the plane of the dissection during rhinoplasty is very important. If you want to have a bloodless field, the plane of the dissection is very important. For the profiloplasty and hump reduction, when you are in the cartilaginous part, you must be in the supraperichondrial plane. And when you reach to the bony part, you must change the plane of the dissection from supraperichondrial to subperiosteal plane. And as I showed yesterday to you, with this elevator, I will change the plane of my dissection from supraperichondrial plane to subperiosteal plane. And I will create a nice pocket and a small pocket here, especially if you want to augment the radix. It's very useful to create a small pocket here. And as I told you in my previous lecture, for better stabilization of the nasal bone, the preservation and attachment of the periosteum to the nasal bone is very essential. So please be very careful regarding the pocket and that you create here, and regarding the periosteal elevation that you want to do here for hump reduction. Another important thing, as I showed yesterday to you, I prefer to reduce the hump by graduated reduction. It means that I will not remove a large piece of the hump in one piece. I will consider enough time, and I will go down little by little, millimeter by millimeter, and in every minute I will check the height of the dorsum, that which height is more suitable for my patient. So please consider enough time for the dorsal hump reduction, and it's my recommendation that graduated reduction or incremental reduction is much better and easier than if you remove a large piece of the hump and you create for your patient a saddle nose deformity. You can see, as I showed yesterday, I will use the number 11 blade. I like the number 11 blade for a profiloplasty and hump reduction, and I will create a cut just at the junction of the cartilage and bone, and then with the use of these types of the osteotomy, I will put my osteotomy below the cutting cartilage, and you can see here, this is the routine osteotomy that I use and I showed yesterday to you. And you can see here, my assistant tap will help me to reduce the hump, and in the majority of cases, I prefer to remove as a one piece, cartilage and bone. But I want to tell you, this is not big issue. If you like to remove the cartilage first, you can do it. Then you can remove the bone. If you want to remove the bone first, you can do it. No big issue that which one is better. But the most important factor is that during hump reduction, you must know the majority of the hump is due to the cartilaginous hump. Please don't remove too much bone from the dorsum, because it's a mistake that you will create for your patients a saddle nose deformity. And then with the use of the different types of the rasp, I will create a nice border and better and smoother border of any irregularity in the bony area. You can see here. And as my colleagues emphasize, please pay attention before surgery to diagnose the pseudo-hump, because it's, at least I think, very common in India. It's common in our country, but when I was in the street, I saw just many of your peoples here, they have pseudo-hump deformity that they need augmentation in the radix instead of the removing of the hump. But you know that many times they need both of them. It means they need radix augmentation and hump reduction. So please pay attention if regarding the radix depth and height before performing any profiloplasty. I want to show you here in this short video clip, as I showed yesterday, how I will remove the hump. You can see here by endonasal approach. I want to show you, you can see here, I will create an incision in the intercartilaginous area. I will, you can see, I will extend my incision around the anterior nasal spine, intercartilaginous incision. I will come around the anterior nasal spine, anterior septal angle, and then I will continue to the membranous septum. Then I will connect these two incisions to each other, and I will reach the anterior nasal spine. You can see here. Then, as I showed yesterday, with the use of a 15 blade, I will create a pocket over the both sides of the nose. You can see here, over the upper lateral cartilage in the supraperichondrial plane. I will create a pocket. And then, with the use of a scissor, with blunt dissection, that you can see I don't have any bleeding here because I'm in the correct plane. You can see how I can elevate the skin and subcutaneous envelope from the underlying bone and cartilage. You can see here how I will elevate the skin and subcutaneous tissue from the underlying bone and cartilage. You can see here. As I emphasized yesterday, for a good surgery, good team of the anesthesiologists are very important. Plane of dissection is important, and the injection is important also. The time and the concentration of the injection these are very important factors that you have a bloodless field for rhinoplasty. You can see here, and I don't use any cauterization during rhinoplasty. You can see here. Then, as I told you, I was in the supraperichondrial plane. Now, I will change the plane of dissection from supraperichondrial to subperiosteal plane. You can see here, I will create a gentle pocket over the nasal bone, especially if I want to augment the radix, because the graft must be below the periosteum for better camouflage of the graft. You can see here. And then with the use of the number 11 blade, I love number 11 blade for profiloplasty. You can see here. You must release all of the attachments. And with the use of the number 11 blade, I will create a cut. And I prefer to remove upper lateral cartilage and just dorsal cartilage in one piece, and I respect to the underlying mucosa, absolutely. And as you can see here, you can see the direction of my hand, that the majority of the hump is due to the cartilage, not the bone. And you can see very gently, I will remove the hump. And then, you can see here how I can remove the bone and cartilage in one piece. And then with the use of the different types and sizes of the rasp, I will smooth any irregularity. I will smoothing any irregularity of the nasal bone. You can see here. And as I told you, I will consider enough time for profiloplasty. Rhinoplasty is for me an art, and you must consider enough time. You know that at least in my country, I have some of my colleagues that perform 10 cases, 11 cases of rhinoplasty per day. Unbelievable. And I tell to them, you are very expert. I am not expert such as you. And then I will correct any dorsal irregularity from the excess upper lateral cartilage, excess dorsal part of the septum, as I told you, by incremental technique. I will go little down, and minute by minute I will check the height of the septum, that which height is better for me. You can see here, I will check minute by minute, and as I showed yesterday, I want to create a nice dorsum for my patients. I want to respect to the time, and you can see a couple of cases here, before, after. These are not perfect results, but I think these are acceptable results, because I want to create for my patients a nice brow tip line. You can see before, after. I don't like to create for my patients too much rotation, too much projection. You can see I like this type of the brow tip line. You can see here, these are not perfect results, but I think acceptable result. You can see here, before, after. You can see from helicopter view, before, after, base view, there is no scar, and the patients are happy. You can see before, after. And as I told you, I like to perform black and white portrait for better assessment of the brow tip line. You can see before, after. You can see before, after. I like to create more for my patient this nice brow tip line. You can see before, after, straight dorsum, strong dorsum, good tip rotation, projection, and I didn't use any type of the graft in the tip area, because I want to see my patients for long-term result. You can see before, after. You can see before, after, not too much rotation of the tip. I like the brow tip line, before, after with endonasal technique, non-destructive technique, very conservative. You can see before, after. As I told you, I like to create for the male patients to create a straight dorsum. I don't like to create for the male patients some supratip break. Thank you very much for your attention.